Hello everyone, my name is Wilbert Monterroza. It is an honor to be part of this panel. I thank David and Joseph for the invitation, in addition to greeting my colleagues from Mexico and Peru. What a good effort to put on the world scene what is happening here in Latin America in this difficult COVID-19 pandemic. I am a multimedia communicator and science journalist since 2016 here in El Salvador, making some efforts to bring science, technology, environment, and health information through the web and social network. I am also a university teacher in the multimedia area and a photographer, and happy to be sharing with the science writers of the city of New York and colleagues around the world. So, El Salvador is a small country in the heart of the continent in Central America. In fact, it is known as the Thumb of America for its only 21,000 kilometers of territory and its more than 6 million inhabitants. On the international scene, unfortunately, my country is associated with keywords such as war, violence, and gangs. And although this is real, the news has been responsible for highlighting these stereotypes. To understand the complex situation that my country is going through, it is necessary to put in a journalistic context from the outside and from within. Outwardly, as I mentioned, the large Spanish-speaking English or other language network, whenever they publish from El Salvador, emphasize three keywords: war, violence, and gangs. In the internal news grid, there are three main topics that absorb the daily informative content: politics, sports, and entertainment. The year 2020 brought news that the rest of the world never imagined its scope and duration, as well as its effects in the economic, social, educational, and other spheres. In March, when COVID-19 transcended from epidemic to pandemic, and its spread was beginning to be dimensioned, mainly due to the displacement of passengers from Asia and Europe, in El Salvador, the government made a decision that was harshly criticized. Considered alarmist at the time because the closure of borders, the isolation of homes, and the closure of the airport, and alerts to the maximum throughout the country were ordered. There, the issue of COVID-19 became an omnipresent issue, and the alarm for the pandemic overwhelmed with the fear of having results beyond the limited capacity of containment of the health system. If there is one word that I can use to describe this entire long process, it is uncertainty. Yes, uncertainty, because as a result of the information from the large news channels and of course the management of the pandemic at the health level in the country, it is worth mentioning that in El Salvador, the Ministry of Health provides services at three levels. The first level is made up of health units: health house and rural health and nutrition center. These are a small center located in populated areas where children and pregnant mothers, dental care, and general medicine are generally cared for. Consultation and medicine are free. Although sometimes the really problem, is the shortage of medicines. The second level by the National General and National Regional Hospital, and the third level is made up of a specialized national hospital. Given the gradual increase in the number of infected in this country, the government announced that what was the largest international center for fairs and convention in Central America, called CIFCO, will be transformed into the new hospital El Salvador, with capacity for 1,000 beds initially, and then another 1,000 in its second and third stage, to care for the sick with COVID-19. The Salvadoran government said that this will be the largest hospital in Latin America. Faced with this general view, which at first sounds encouraging, the unknown of the capacity of intensivist doctors arose capable of giving adequate attention to the situation in number on demand, and because in the world this disease has exceeded the capacity of doctors, nurses, and other frontline personnel, El Salvador was no exception. I think that Latin America is in the self level. I also want to talk about the biosecurity message that were implemented and how we are at the moment at the level of official figures. Through radio and television networks, the government initiated calls for avoid leaving the house, washing hands, going out only if necessary. Food aid was promised distributed throughout the country. A plan was proposed so that the rates for water, electricity, and telephone could be postponed for 3 months. That is, what was consumed in that period will then be charged in a staggered manner to help the family economy. Then the exit by numerical termination was implemented according to the official identity document to avoid crowds in shopping center. Another thing, and the use of public transport was suspended. In this context, I have to mention that in an economic level, the situation was exacerbated by unemployment, business closure, that is general view, very similar to the rest of the world, but with the accent of the historical problem of a country that comes from a post-war process 28 years old. At the level of official updates statistics, which are under the scrutiny of the national press, the data for COVID-19 in El Salvador are confirmed case 42,132, recovered case 38,260, activate case 2,260, local case 38,837, imported 117, deceased 1,212. Test performed like PCR 587,066. At the level of journalist coverage, it became difficult from my personal experience to be able to cover a story because I am a freelance journalist. I do not have a vehicle in the web platform that was sustained with my income as a university teacher had to be suspended because I was left without work. However, I have continued doing interviews that I later upload to YouTube. please, you can see my channel in YouTube. Giving lecture and trying to alleviate the situation. In other words, sorry, I consider it important to mention these personal issues because I know that many fellow journalists are experiencing difficulties on the one hand in their homes and in the need to report in a better way, but limited by not having a sponsor or the opportunity to enter to the large traditional media because there he is not considered a science journalist. I repeat, in my country, in El Salvador, I think is the South in Latin America, what fills the newspaper, TV, radio, and digital media are news about politics, sports, and entertainment. Science notes are something sporadic, came in or science news from Europe, Asia, or the United States. There is not continuous deep approach from which the population can have a reference in a mass media. This is a consequence opens a field for misinformation, pseudoscience, to the mixture between apocalyptic beliefs and conspiracy theories. Certainly, the world of science journalists is almost always uphill. But this pandemic made the journey heavier, but I do not want to close with pessimism. I believe that the news of the vaccines is a ray that gives us hope. And that we must continue. But there are profound lessons that we must join force among Latin Americans with colleagues from the United States, Europe, Asia, and the world to strengthen our work. Make it more visible in decent conditions for journalists, disseminator, and communicator, because science is everywhere, and without science, there is no future. Thank you very much. Hello, dear fellow journalists. I want to apologize for a last-minute family health problem, but I hope with my small contribution to give visibility not only to what happened in our journalistic work during the pandemic, but this can add to generate better ideas and condition for the next year. Hugh from the city of San Salvador in El Salvador. See you later.